Hello everyone, welcome to our YouTube channel for nurses preparation. I am Neeraj Kumar Kaithal. Today we are presenting 100 plus important questions for upcoming Community Health Officer exam 2020, CHO exam 2020. So everyone, let's begin our today's video. In the first point, we are discussing about the elements of primary health care. Primary health care elements, it is a very important topic for the CHO exam. There are total 8 elements. To remember this, we have a mnemonic, it's called elements. To remember elements of primary health care, we have to remember the word elements. ELEMENTS. Total 8 elements are there in primary health care. First, E. E stands for education. We can say health education. L for locally endemic disease prevention and control. E for essential drugs. M for maternal and child health including family planning. E for EPI, expanded program of immunization. We can simply call it as immunization. Next is nutrition and promotion of proper food supply. And the second last is T for treatment, and the last one S stands for sanitization. We can call it as water and sanitization. Let's have a quick revision again about this. All the elements of primary health care: health education, locally endemic disease, prevention and control, essential drugs, maternal and child health including family planning, immunization, nutrition and promotion of proper food supply, treatment, and water and sanitization. Next is first drug used to treat leprosy. Dapsone. Dapsone is the first drug that is used in the treatment of leprosy. Leprosy is a bacterial disease caused by the microbacterium leprae. Next is closure of fontanelles in newborn baby. The anterior fontanelle of a newborn baby is closes around 1.5 years of age, where posterior fontanelle in a newborn baby closes around 1.5 months of age. It is anterior closes 1.5 years, posterior closes at around 1.5 month. Remember, it is an important question. Next is blood vessels are found in our dermis layer. The outermost layer of our body is epidermis, and dermis layer is found just beneath epidermis. Microscope discovered first microscope is discovered by Antony van Leeuwenhoek. Electronic microscope is discovered by Knoll and Ruska. Next is live attenuated vaccines are contraindicated during pregnancy. Example of some live attenuated vaccines are rubella, measles, mumps, and varicella. Next is contraction of erector pili in our skin is related with the warming mechanism. Vibrio cholera is a coma-shaped bacteria. Next is xerostomia. Xerostomia is a dryness of mouth due to deficient of saliva. Ostomia means opening of mouth due to decreased saliva. INH. This word is used to describe isoniazid drug. It is an anti-tubercular drug. It is most common drug that have higher resistance in India. Next is Colles fracture. Fracture of distant radial bone. Fracture of distant radial bone is known as Colles fracture. This is the distant part of radius bone. If the fracture occurs in this area in the radial bone, it is known as Colles fracture. Now, let's talk about the Florence Nightingale's death. She was dead at 13 August 1910. She was born in Italy at 12 May. His birthday is celebrated as International Nurses Day. She is known as Lady with the Lamp. She is also known as pioneer of modern nursing. Now let's talk about the Pott's fracture. It is a fracture of lower end of fibula. Fibula bone is found in our leg. If this bone is fractured, this fracture is known as Pott's fracture. Now let's talk about the very important topic for CHO exam. we are discussing about BCG vaccine. First, BCG full form Bacillus calmette-guerin. It is given at the time of birth and the dose will be 0.05 ml. If it is not given at the time of birth and given at 1 month of age, the dose should be 0.1 ml. The BCG vaccine is given in left arm at the deltoid muscles. It causes permanent scar. You can see in your left arm at the deltoid muscle region a scar, wheel-shaped scar. It is due to the BCG vaccine. The BCG vaccine is a live attenuated type of vaccine. It gives us protection from tuberculosis disease. Temperature of storage is between 2 to 8 degrees centigrade. It is diluted with the help of normal saline. Now we talk about the first cell of life, that is zygote. Zygote is formed due to the combination of sperm and ovum. This process is known as fertilization. 0 to 2 weeks zygote, 2 weeks up to 8 weeks embryo, 8 to 40 weeks it is known as fetus, and now the baby is delivered. Now it is known as neonate up to 28 days. There is two type of neonates, early neonate and late neonate. The newborn baby up to 1 to 7 days of life known as early neonate, and from 7 days to 28 days of life it is known as late neonate. The newborn baby from 28 days up to 1 year known as infant, and from 1 year to 3 years it is known as he is known as or she is known as toddler, and from 3 to 6 years known as preschooler, 6 to 12 years known as schooler, 12 to 18 years it is known as adolescent, and up more than 18 years it is known as adult. Now we talk about the primary healthcare principles or pillars. It can be asked as pillars or principles. There are total 4 pillars or principles of primary healthcare. Important topic this is. First is equitable distribution. The second principle is community participation. Third one is intersectoral coordination, and the last one is appropriate technology. In this video we are trying to cover all important points quickly, so we are not describing any points in detail. If you want to learn about this primary healthcare principles, you can write in the comment section. We will make a different video soon. Now we talk about bird flu is caused by the virus. Bird flu is a viral disease. Ciliated epithelium tissue is found in uterine tube. Ciliated epithelial tissue found in uterine tube, they helps in the movement of ovum. Commonest cause of neonatal death in India is prematurity. Total genetic material of an organism is known as genome. Genome is a total genetic material of organism. COVID-19 is an example of pandemic disease. What is pandemic? Pandemic means spread of a communicable disease. Spread of a communicable disease across a large region, country or country to country or worldwide is known as pandemic disease. Suicidal risk is highest in major depression. Persons who have major depression may have highest suicidal tendencies. Total number of ribs 12 pairs, and there is total 11 pair of intercostal spaces found between the ribs. Anxiolytics are the drugs that is used to relieve anxiety. RBC storage temperature 1 to 6 degrees centigrade. Adam's apple is the most prominent in adult male. Adam's apple is most prominent in adult male. It is seen in your neck. Strawberry appearance of cervix is seen in trichomonas disease. Strawberry-like appearance of cervix in female is seen in trichomonas disease. Vitamin C, also known as ascorbic acid, is helpful in wound healing. Cryptorchidism. What is cryptorchidism? It is a failure of one or both testes descent in scrotum. Failure of one or both tests descent in scrotum is known as cryptorchidism. Drug that reduces fever known as antipyretic. 1 ounce equals 30 gram. One Anganwadi worker covers 400 to 800 population. Tuberculin test was discussed by von Pirquet. Enteric fever is caused by the Salmonella typhi. Enteric fever also known as typhoid. Next question is from anatomy. Right lung contains 3 lobes, left lung contains 2 lobes. Trachoma is a eye infection. Immunization comes under primary prevention. Early diagnosis and treatment comes in second prevention. Florence Nightingale was born 12 May in 1820. There are total 3 auditory ossicles. These are malleus, incus and stapes. Malleus is a hammer-shaped bone and stapes is our body's smallest bone. All these auditory ossicles or bone are the part of middle ear. Full form of ABG is atrial blood gas analysis. 1 liter equals 1000 ml. Now talk about prevalence. What is prevalence? Prevalence is the total number of all individuals who have particular disease at a particular time. All individuals who have particular disease at a particular time known as prevalence. Trained eyes covers 1000 population. Major cause of maternal mortality in India is hemorrhage. Major cause of maternal mortality in India is hemorrhage. Next is substance used to counteract the effect of poison is known as antidote. Sexually transmitted diseases, STDs, also known as venereal disease. Now let's talk about the smallpox. Last case of smallpox disease seen in India. Last case in India was seen in 1975. Eradicated from India. Smallpox disease was declared eradicated from India in 1977. Last case of smallpox disease seen in the world in 1978. Eradicated from the world in 1980. An intentional touching of the patient's body without consent is known as battery. Now let's learn what is the purpose of shake test. Shake test is done to assess the fetal lung maturity. To assess the fetal lung maturity, we perform shake test. Eyes and genital area should be covered during phototherapy. Eyes and genital area of a newborn baby should be covered during the phototherapy process. NPCB, full form of NPCB is National Program for Control of Blindness. National Program for Control of Blindness. It was launched in year 1976. Inner ear also known as labyrinth. Inner ear is also known as labyrinth. MPHW, full form of MPHW is multi-purpose health worker. Multi-purpose health worker. They appointed at the sub-center level. Sub-center is opened in the hilly and tribal area at the population of 3000 and in the plain areas at the population of 5000. Hand washing is the most effective way to prevent cross-infection in hospital setting. Hand washing is the most important way to prevent cross-infection in hospital. Malaria mainly affects spleen. Spleen is mostly affected in the malaria disease condition. Malaria is caused by Plasmodium. Inflammation of stomach is known as gastritis, where inflammation of mouth is known as stomatitis. Vaccine can be stored in cold room for up to 3 months. In cold rooms, we can store vaccine up to 3 months. Hay fever is caused by Coxiella bruneti. Coxiella bruneti is the causative organism of hay fever. VHG, Village Health Guide, cover 1000 population. Yellow fever is caused by the Flavivirus fibricans. Flavivirus fibricans is a causative organism of yellow fever. Combined vaccine examples are DPT, MMR and pentavalent. Pentavalent vaccine contains DPT, hepatitis B and Haemophilus influenza B. Trismus means lockjaw, Rhizus sardonicus and opisthotonus. All these symptoms or conditions seen in tetanus disease. Tetanus is caused by the Clostridium tetani. ASHA full form, accredited social health activist. ASHA covers 1000 population. In twin pregnancy, most common complication is preterm delivery. Preterm delivery is the most common complication of twin pregnancy. Heat regulating center of our body is hypothalamus. Hypothalamus is known as heat regulating center of our body. Ideal contraception for newly married couple is combined oral contraceptive pills. It is also known as honeymoon pills. Health assistant, posting of a health assistant. In hilly areas 20,000 population, in plain areas 30,000 population. Next is projection. What is projection? When an individual blames others for his own mistakes, known as projection. Primary health center total beds for indoor patient is 6. Now let's talk about the DPT vaccine. DPT stands for diphtheria, pertussis and tetanus. DPT vaccine is now included in pentavalent vaccine. The dose of this vaccine is 0.5 ml. Do not use this vaccine in freezer. If someone is by mistakenly stored in freezer, then you should discard this vaccine. Do not use after stored in freezer. Its route is intramuscular region anterolateral thigh. Its total 5 doses are given at 6 weeks, 10 weeks, 14 weeks and 16 to 24 weeks, and the last dose is around between 5 to 6 years. Fever may occur after vaccination. Next is non-oxynol 9. Non-oxynol 9 used for vaginal sponge. It is come with the name of today. Let's talk about the electrocardiography ECG. If in ECG you see tall T wave, it indicates hyperkalemia condition. If you see prominent U wave, it denotes hypokalemia condition. Tall T wave seen in hyperkalemia, prominent U wave seen in hypokalemia. Apgar scoring system. Apgar scoring system given by the Virginia Apgar. This Apgar system is mainly used to decide at the time of health of a newborn baby. If the total score in this Apgar is 0 to 10, minimum score shows distress in baby, maximum shows good health. If the baby's Apgar score at the time between 0 to 3, it means the baby is in distress. We have to perform resuscitation and O2 support to the baby. If the score is between 4 to 6, it means baby have a little distress. We have to give oxygen and routine care in this score. If the baby's score is between 7 to 10, it means the baby is healthy, no need to give additional care, just perform routine care. Now let's talk about all the parameters that are used to decide the health of baby in Apgar condition. First, A means appearance, P means pulse, G means grimace or reflex, A means activity. This activity means muscle activity. And the last one is respiration. Let's first talk about the appearance. If the baby have normal complete blue body, if the baby is having complete blue body, this time we will give 0 marks. The baby is in distress condition. If the baby's body is pink and extremities are blue, in this condition we will give 1 mark. If the body is completely pink, all the body and the extremities are pink, it means the baby is in good health condition. We will give this time 2 marks. Next is pulse. If the pulse rate is absent at the time of birth, it means we will give 0 mark. If the pulse rate below 100 beats per minute, we will give 1 mark. If the pulse rate is more than 100 beats per minute, we will give 2 marks. Next is grimace or reflexes. If the reflexes are absent, we will give 0 mark. If the poor or flaccid reflexes are present, we will give 1 mark. If the good reflexes are present, we will give 2 marks. Now let's discuss about the activity or muscle activity. If there is no movement, it means 0 mark. If there is a little movement, give 1 mark. If the active movement present, then give 2 marks. And in the last, we will discuss about the respiration. APGAR means respiration. If the respiration is absent, it means give 0 mark. If the respiration is slow and irregular, it means give 1 mark. If the respiration is good and regular, baby is crying, then give 2 marks. So this is all important about Afghani scoring system. If you want to take a snapshot, screenshot, you can take for your revision purpose. About the IUD or IUCD. IUD stands for intrauterine devices. It is also known as IUCD, intrauterine contraceptive device. IUD insertion, commonest complication. When we administer IUD, the most common complication is bleeding. Next, best time for testis examination. Best time for testis examination just after the shower or just after the bath. Next is MPHW, multi-purpose health workers. Example, female health worker and male health worker. These multi-purpose health workers are appointed upon sub-center. As we all know, sub-center is open at the population between 3000 to 500. 3000 population in hilly areas, 5000 population in plain areas. In the increased intracranial pressure condition, drug of choice is IV mannitol 20%. In a person who is suffering with increased intracranial pressure, we administer IV mannitol 20%. It is a drug of choice in case of increased ICP. Next is histamine test is performed to diagnose leprosy. Histamine test is performed to diagnose leprosy disease. Leprosy is caused by the Mycobacterium leprae. Gonorrhea is caused by the Neisseria gonorrhoeae. Gonorrhea disease caused by the Neisseria gonorrhoeae. In community health center, minimum beds are, in community health center, minimum beds are 30 beds. Measles vaccine and oral polio vaccine should be stored in deep freezer. Oxytocin, also called pitocin, its complication is uterine tetany. Oxytocin is given to start uterine contraction at the time of labor. Projectile vomiting is seen in pyloric stenosis condition. Most important question, heparin drugs antidote. Heparin drugs antidote is protamine sulfate. Protamine sulfate is the antidote of heparin. Next, best time for breast self-examination screening is 1 week after menstrual cycle. Bull-necked appearance is seen in diphtheria. Nitrogen cylinder color black. One village health guide is appointed upon 1000 population. The school health program was initiated in the year 1962. Oral contraceptive pills OCP should be taken at the same time of each day to maintain hormonal level of the drug. Total lung capacity is 6000 ml. Total duration of postnatal period is 6 weeks or 42 days. Full form of DMPA, dipot-medroxyprogesterone acetate. Dipot-medroxyprogesterone acetate is a full form of DMPA. Next, let's talk about the measles vaccine. Measles vaccine is developed from the chick embryo cell. 2 doses of measles vaccine is given. First dose is given at 9 months of age and the second dose is given 16 to 24 months of age. With the measles 9th month dose, vitamin A's first dose also given 1 lakh international unit. Complication associated with the measles vaccine is toxic shock syndrome. Diluted vaccine should be used within 4 hours. If the measles vaccine is diluted, we must use this vaccine before 4 hours, otherwise it should be discarded. Next, major cause of perinatal mortality is birth asphyxia. Case findings in R and TCP is based on sputum microscopy. R and TCP's full form is Revised National Tuberculosis Control Program. This post came in 1962. Next is who given the germ theory of disease? Germ theory of disease is given by the Louis Pasteur. Father of microbiology, Louis Pasteur. Father of bacteriology, Louis Pasteur. Egg is also known as biological complete protein or reference protein. Important sign of respiratory distress in preterm babies is nasal flaring. Nasal flaring is an important sign of respiratory distress in preterm babies. EPS, extrapyramidal side effects are caused by antipsychotic medicine. DALY, full form is Disability Adjusted Life Year. Disability Adjusted Life Year. ECT's full form is Electroconvulsive Therapy. Amnesia means absence of memory. Mutism means inability to speak. Barometer of social welfare is TB. Important point. Barometer of social welfare known as TB. OPV, oral polio vaccine, is discovered by Sabine. Killed polio vaccine is discovered by Salk. IPR theory. Theory of interpersonal relationship is given by Pavlov. Thank you so much friends for watching this complete video. These all the points are very important for upcoming community health officer exam, CHO exam 2020. If you find this video is helpful, then please click upon the like button, share this video with your friends and please subscribe our YouTube channel for nurses preparation for more such interesting videos. Thanks for watching once again and all the best.